Well, I'm Dr. Carlos Escobar. I'm an aesthetic doctor. Have a clinic in North London. It's called the Access Clinic. And yeah, tonight I would like to introduce you to a treatment option for menopause hair loss. So first of all, what's the female pattern hair loss? In the past, this can be known also as androgenic alopecia. It used to be known as that. But obviously, as you know, we discovered more about it, and because we saw it happening in female patients, we realized that the androgens have don't have all of it to do with it. So that's when the term female pattern hair loss appeared. It is because it happens after following the menopause, right? There was a British study in 2001 where they discovered that about 38% of women after 70 years, that 70 years old, had this problem. Although they did not realize about it, they never came looking for help. They just found this randomly, and we can see here the hair loss pattern that happens, which is known as the Christmas tree pattern, which normally happens at the top of the vertex of the scalp, as opposed to other types of hair loss that happen at the sides, like the telogen effluvium. This was explained a bit, but basically, when hair follicles we have at the bottom, at the something called the dermal papilla, and this cells they secrete growth factors, and they help development of the hair follicle. Many of these growth factors are very important, and they help with the cell lining in the hair follicle, and they help as well with something you've already seen, which is the hair cycle, the hair follicle cycle, which again the most important one is the anagen one, which is the active growth phase. It takes about a few years, and normally during the female pattern hair loss, what happens is that that phase gets shortened by about a couple of weeks or months, and this is the problem that happens with female pattern hair loss. What happens is this is called follicular miniaturization, and this is the visible thinning of hair over the frontal scalp and the vertex of the scalp. Like I mentioned, instead of taking a few years to the anagen phase to take a few years, it takes only a few weeks or months. And the proposed theories are obviously initially, because it used to be seen in males, it was the theory that testosterone has a role with this sort of problem. Although obviously, as we see it in women and women who are in menopause, we figure out that maybe that's not really all of it. So also it led to the possibility of a role for estrogen. But still, there's a lot of conflicting evidence around this, and there's a lot to be done. Now, when you come to your doctor and you want to do something about your hair loss, your problem, the medical assessment involves a few things. Obviously, the patient history, knowing the age of the patient, knowing what the symptoms are. This can lead us to other things like problems with other health problems, like thyroid problems, vitamin problems, deficiency problems that can lead to hair loss. But obviously, if menopause might be the main cause, then we just carry on studying it. We do also lab tests that helps us figure out if maybe it's a testosterone-related problem, and then we can jump into the treatment, which in this case, already been mentioned. The few therapies are already existing. Minoxidil is one of them. Finasteride is one of them, and obviously the hair transplants. I want to focus a bit on platelet-rich plasma. Why? Because the treatment that I'm going to introduce you today, it's a bit related to this. PRP, maybe you might have heard of it, is when they draw blood from you. They just put it in a centrifuge, they spin it, and they draw this bit that's called plasma, and it has many growth factors in them. The growth factors that I mentioned, the dermal papilla release. Now, as we age, our health declines. So PRP might not be the best for people who have menopause. So we need another option that perhaps can give us better growth factors in a higher quantity, and then that are very effective, safe and effective, which is what I'm going to introduce to you today. So this product is called Calysim. The main ingredient in this is called PTT6. That's the name of it. It has been used obviously in aesthetic clinics. Initially, it was used for skin treatments. And then it was introduced as a hair. It was found to have really good results on the hair. It has active exosomes in it, growth factors, and other proteins that help a lot with the follicular stimulations. So how do these growth factors work? Is they send messages in our body to release specific nutrients that help the development of the hair follicle. Again, like I mentioned, it creates cellular proliferations and prolongs the anagen phase. That phase normally takes years. We try to prolong that phase, so that's what this product does. It induces the cell growth and the follicle development. A few of the growth factors are obviously included in this. Is a hepatocyte growth factor. It helps with the follicular epithelial cells, the basic fibroblast growth factors. It releases fibroblasts. The vascular endothelial growth factor. It helps promote new vascular formation for increase the blood supply in the area, which is very important as well. Transforming growth factor, insulin-like growth factor. This is pretty much like the growth hormone. That is the part that is very active in the growth hormone, and the platelet-derived growth factor. So these are a few of the growth factors that we want to stimulate in the scalp to promote the hair follicle growth. So quickly about this product, how it's used, how it's done in the clinic. Obviously, we disinfect the scalp. Then we apply the vials come in 5 milliliter vials. We apply half of it while we microneedle as well. 0.5 millimeters to 2 millimeters long needles, microneedles. Then after that, we apply another 2.5 milliliters on top. This is meant to be done once weekly for 6 weeks. And depends on the severity, we can actually increase it to 12 weeks. But we've seen really good results with this. And you have to top it up or do a maintenance a maintenance session every month. That's the best thing you could do for about a few months later. And then if there's also an option you can do the maintenance at home, which is provided with a stamp, that stamp is only 0.5 millimeter needles. So obviously, the first time around you do it, it's better to do it in the clinic. So your practitioner might be able to have a good view of the scalp and do it in all the areas that are required to be done. But then after, you can also follow it up, maintenance at home with the derma stamp that is included in this. So this is how it's done with the microneedling. I think you can't see the vial there, but it's just you're applying the vial and doing the microneedling. Well, the results, now, why is it different? This system different to, why would you go for this? Well, first of all, because most of the users report really seeing good results after 6 to 12 weeks. You see increase in the thickness of the hair, the number of hair follicles in there, and the number of visible terminal hair. It's safe to use. It's been proven it's absolutely proven to be very effective and also safe. There's no side effects at all. And it's obviously another thing I forgot to mention, is it's very effective for other types of hair loss, not just for the menopause related ones. So if you have like telogen effluvium, like I mentioned, or sometimes if it's male patients, if they have androgenic alopecia, it helps a lot as well. This some of the results that you can see after the treatment, after the course. We have seen 15% increase in the number of active hair follicles on the scalp, 14% increase in the total number of hairs on the scalp, and 16% increase in the hair width, the thickness of the hair. Some of the results here you might see, just so you have an idea of it. This after most of them, after 6 weeks of treatment only. None of these required the 12-week course. So we see really good results, as you can see, the increase in the thickness, the increase in the number of hairs. Yeah. And yeah, well, that's basically it. You can, like I mentioned, order this online as well. So you can apply it yourself like this. This is the way you can also apply it. Can't hear anything at the moment. But yeah, any questions?
Thank you so much. Does anyone in the audience have any questions for Dr. Carlos? Yep, I'll bring a microphone down to you now. Bear with me.
Did you say that you used half of the vial in the treatment in clinic?
You use the whole vial in clinic.
Okay.
But it's just that when you do the first pass with the microneedling, you use half of it and then you apply the other there, just there and then. But it's the whole vial in clinic. If you want to do it at home, you only have to apply half of it with the dermastamp, and then the other half the next session you want to do it. But in clinic, it's recommended to do the whole vial.
Okay, so what you mean is you have half a vial on one side and another half on the other?
No, just the microneedling process
Yeah.
is one thing. You create those microchannels initially, and while you're doing that, you can apply half of it. After you finish the microneedling process, because you've created those channels will remain open for a bit, so you just apply another layer that will actually penetrate because the microchannels are there.
Okay.
So that's why you do it like that, because the microneedling, at least the microneedling device, is more effective at creating those channels than, say, the dermastamp, because of the length of those needles. The length of the needles with the microneedling device is up to 2 millimeters, 1 millimeter, 2 millimeters, whereas with the stamp, the dermastamp that it's included in the home kit, is 0.5 millimeters.
So you're saying 0.5 is better than 2 millimeters?
No, definitely going up to 1 millimeter is much better because the hair follicle lies at the 1 millimeter depth.
Okay.
But the dermastamp, using the dermastamp at home is still effective, very effective for maintenance purposes. But it's much better if you do it in the clinic. You'll see better results and more effective results if you do it someone else is doing it in clinic with a deeper, length of microneedles.
Do you have any experience or views on the use of retinol, vitamin A, on the scalp?
No, I don't use any sort of retinoids in the scalp. No.
Thank you. Are there any more questions? No. Okay. Thank you so much, Dr. Carlos. That was an excellent talk.